to this essential guide brought to you by the American Hernia Society, the worldwide authority on hernia surgery. Our mission is to unite expert hernia surgical leaders from around the globe to advance the science and treatment of hernias. Together, we're here to support you every step of the way. In this video, we'll discuss the top 10 questions you should ask your hernia surgeon. These questions are designed to empower you with knowledge and ensure you have a thorough understanding of your procedure and recovery.
When preparing for hernia surgery, it is crucial to ask the right questions. By asking these 10 questions, you can gain clarity and confidence in your treatment plan. Let's explore them together.
Number 1, what is a hernia? What caused my hernia? There are different types of hernias, and each has its own different causes or risk factors. Learning what type and kind of hernia you have is important because different hernias can have different treatments.
Number 2, what if I don't have surgery for my hernia? Non-operative management of hernias is appropriate for some types of hernias. If this is something that you're considering, ask your surgeon if choosing to live with your hernia is safe. What can you expect to happen to the hernia over time? Do you have to restrict your physical activities? And what is the likelihood that your hernia will become an emergency?
Number 3, if I decided to have hernia surgery, how can I optimize my surgical outcomes? Your overall health can impact your surgical outcomes. Ask your surgeon if you have to adjust any of your medications before your surgery. If you have chronic medical conditions, such as tobacco use, diabetes, or obesity, ask your surgeon if these can be improved before the surgery. What are the different surgical options to fix my hernia? There are a number of different ways to perform hernia surgery. Some use your own tissues, and some use hernia mesh. Some are performed using traditional open surgery, laparoscopic surgery, or robotic surgery. Ask your surgeon about what option they think is best. Ask about the length of the operation and how long you'll be in the hospital for.
Number 5, what are the common complications of hernia surgery? All surgeries carry some form of risk of complications. Ask your surgeon about the different type of complications and how serious they are, and whether these complications occur during surgery or after surgery. If they do happen after surgery, ask how long after surgery they can happen and what symptoms you should be looking for to identify complications. Learn about how to contact your surgeon if you suspect you have a complication.
Number 6, what are the benefits and risks of hernia mesh? Hernia mesh is frequently used for hernia surgery. Ask your surgeon to explain to you what a hernia mesh is and how it helps the hernia repair. What are the risks of using hernia mesh? The American Hernia Society has created an advisory document to help educate patients and other physicians as to the safe use of mesh for hernia repairs.
Number 7, what's the likelihood of hernia recurrence? Hernias can come back after surgery, and this varies based on your overall health, the type of hernia, and the operation performed. Ask your surgeon about the likelihood of hernia recurrence and the signs that you should be looking for to identify a recurrence.
Number 8, how much will my surgery cost? Different patients have different healthcare insurance plans, and the cost of surgery varies based on the planned operation and your individual insurance plan. Some surgical practices can provide you with an estimate of your financial obligation. I would strongly advise you to reach out to your insurance carrier to understand your plan well and avoid any surprise medical bills.
How long is the recovery from your surgery? Different hernia surgeries have different periods of recovery. Ask your surgeon about how much pain you can expect after surgery and if you have to avoid any physical activities after surgery and for how long. Ask about any dietary instructions and how soon you can resume exercising and driving.
Number 10, how long should I take off work and other physical activities? Ask your surgeon how soon you can expect after your surgery to safely return to work as well as other physical activities. This can vary based on the type of surgery you received and your particular job. If your job is physical, ask your employer whether there are light duty options and if there are any forms that need to be completed. If you need your surgeon to write you a letter or note, be sure to ask what the process is to complete the forms.
By asking these questions, you'll be equipped with the knowledge needed to prepare effectively for your hernia surgery and ensure a successful recovery. It is important to use these questions as a guide while also following the personalized advice of your surgeon and other healthcare providers. Please note that the information presented in this video reflects the opinions of individual members within the American Hernia Society, does not constitute medical advice. For further guidance and resource to support your journey through the hernia surgery, please visit our website at americanherniasociety.org.